Welcome to another episode of In Their Words, brought to you by UPMC in Central PA and the UPMC Pinnacle Foundation. In this follow-up to our previous episode, we dive deeper into the world of grant funding and its real-world impact. Today, we're joined by Mindy Reighard, Manager of Grants and Contracts at the UPMC Pinnacle Foundation, to discuss the Mobile WISH, or Women's Health Services Unit, a groundbreaking initiative supporting women's gynecological needs. Mindy will take us behind the scenes, revealing the intricate process of securing funds and bringing this vital project to life. You'll learn how the UPMC Pinnacle Foundation transforms ideas into action, making healthcare more accessible for women in our community. So sit back, relax, and join us as we explore the powerful impact of grants on community health.
My name is Mindy Reighard, and I'm the Manager of Grants and Contracts with the UPMC Pinnacle Foundation. I've worked with the foundation for 6 years. Prior to that, I worked for a couple of different community organizations in Lancaster. And what really brought me to this kind of work is my background with writing grant applications as well as reviewing funding requests that we get. I have to say the Wishmobile is something we're very interested in tracking and learning more about. The way in which foundation funding works here at the UPMC Pinnacle Foundation, we have several pillars or focus areas that we're interested in funding. And one of those is doing whatever we can to support the needs of vulnerable communities. We do a lot of work with social determinants of health, and obviously under-resourced communities have tremendous need. They often lack access to care. They often have many barriers that keep them from getting care, whether it's transportation, childcare. They don't know where to go for help. Many times, people within vulnerable communities do not have a primary care provider. So when a serious issue arises, they don't have the ability to get referrals for things. What's really attractive to us about this model with the WISH Mobile is that really targets many things. Social determinants of health regarding women who are either under-resourced or experiencing homelessness, who, for a variety of reasons, don't have access to the kind of preventative care that other women do. So if they're not getting mammograms, not getting testing for cervical cancer, not getting other things, then oftentimes they will end up arriving in one of our emergency rooms with a very, very serious issue. So we like this because it provides preventative care, and it just provides testing that these women deserve to have as much as anybody else. How this came about, which is how a lot of things, we operate, and many times is we had clinicians who approached us and had a lot of interest in having a mobile unit that could go around to communities, particularly areas where we knew there were higher levels of homelessness, and to start kind of doing outreach in those communities to encourage women who don't have access to regular care to visit the mobile unit so that they could get necessary testing done. Right now, the WISH Mobile is actually partnering with our addiction medicine program to use their vehicle 1 day a week. And the hope is we are really looking at this as a pilot program. The hope is that as the word gets out, that these services are available, and so much of it is word of mouth, particularly within vulnerable communities, working with FQHCs, working with a wide variety of community organizations, that more and more women will feel comfortable coming to the mobile vehicle to get the kind of care that they need. We have clinicians then who staff it, who can do the testing, who can do follow-up with them, and can also speak with them about social determinants of health and maybe get them other help, refer them to other community organizations. It's so important as a hospital system that we do have deep roots in our communities and understand what is going on so that we can provide the kind of care that folks need. So really what we kind of reached an agreement, I guess you could say, with our clinicians that we wanted to pilot this program for a year, knowing that it takes a lot of time to build up trust with this patient population. And then we will consider either possibly funding a vehicle of their own, looking for grant funding for a vehicle of this kind. But by piloting for a year, it allows us to kind of work through the operations end of it, see what works, what doesn't work, make sure that we would be ready to go to expand our hours.
Grant writing is not only about technical skills and understanding, but about passion. Listen in as Mindy tells us how she came to work for the UPMC Pinnacle Foundation, how her beginnings and education brought her here, the place where she helps make such a difference in the Central PA community.
So actually, I was an English major in college, so always obviously did a lot of, was prepared to do a lot of writing. And then right out of college, I worked for the United Way of Lancaster County. And I was actually more on the development side, working with our Alexis de Tocqueville Society, working in major giving. So I, right away through that work, really developed a love for nonprofit work. I loved that we were raising funds to help people in the community. And we just had a unique advantage in doing that. So I think that's really what started my interest in this kind of work. I was actually when I was hired by the UPMC Pinnacle Foundation 6 years ago, it was more around doing grant writing for the foundation, which I do. But then as, things changed and the foundation has grown and evolved, I also have kind of wear two hats. I write grant applications that support our efforts within the health system, but I also review the funding requests that we receive from either within the hospital or from what we call community partners, organizations within the community that our clinicians either refer patients to or they refer patients to us, that we kind of work in tandem together to assist patients. So it's very interesting doing both sides of that work. I think both my work as grant writing kind of helps me to understand where organizations that are looking for funding are coming from. But at the same time, working with those folks, particularly our community organizations that apply for funding, I learn a lot from that. I've learned a lot from different organizations that I really had no idea what they did. And I've just learned so much about how hospitals, the incredible and the depth of the reach we have within communities that I guarantee the average person would have no idea. It goes far beyond the walls of our hospitals and clinics. When you speak with a lot of our clinicians, they have a very solid understanding of where hotspots are for addiction medicine, where, the homeless population. They really get to know the communities in which our hospitals exist. And we really do try to go out of our way to do some preventative work, as well as meeting the immediate needs of our communities. And we can do that by grant funding that we get either from the federal government or the state government, or by foundation funding.
When it comes to the work at the UPMC Pinnacle Foundation, there are several reasons why Mindy and her team seek funding for certain vital projects. Those reasons are the 3 pillars.
Right now, our 3 pillars are serving vulnerable communities, so communities at risk, people who really have face incredible barriers to receiving care. They could be uninsured or underinsured folks. Often they don't have primary care providers. They often are the folks who use emergency rooms for all their care because they just don't have access to primary care. And it's amazing the number of people who just lack transportation to get to a physician, particularly because they don't have insurance, have no idea how to access it. So that's one of our priorities. And then the other, you mentioned population health, community health, I kind of see as the same thing. And those are things like our addiction medicine program, our street medicine program. We have diabetes prevention groups where we work with folks who either have diabetes or are at high risk for diabetes. And there are support groups where physicians are actually involved in that to try to help them make changes in their lifestyle and their health habits to prevent them from having to be on medication for the rest of their lives. We also have things like our Nurse Family Partnership Program, where we have nurses who go into the homes of single women with children from the time they're pregnant to the time that child is 2 years old and monitor their health outcomes, teach them how to be a mom. Many of these women, unfortunately, did not have good role models themselves. And they also monitor the health of the child, which is typical with community medicine. It goes further than that because we have a social worker who works just in that program. She helps them with finding a job. They help them with childcare, help them with all kinds of other issues that are barriers to them with leading a successful life. We have our Child Advocacy Center, which is a clinic that sees children who have been referred by law enforcement who are suspected of having suffered either physical or sexual abuse or are victims of neglect. And our staff there works very closely with law enforcement, and they provide a medical exam for these children in a very non-threatening way. They also receive behavioral health therapy and work on using trauma-informed care. And they will also refer those children and their families to other kinds of community supports. So I really see that as kind of our community medicine, where we're actually not just seeing folks in an exam room, but also really working very diligently on social determinants of health, removing barriers to care, getting them, we call them wraparound services, where we identify, do they have food on the table? Are the children going to school? Are they receiving therapy, that behavioral health therapy that they need? And trying to make sure that they are able to access other community supports. And then our third pillar, workforce development, I think, as everyone probably knows by now, healthcare right now is still, we have incredible shortages and clinicians really across all of our service lines. It grew a lot after COVID and has continued. So the foundation funds a wide variety of workforce development programs where we offer tuition reimbursement for folks who are in training to be technicians or nurses or all kinds of different positions within the hospital. And that is something that is a big focus to us because obviously we want to have enough people to be able to provide the care that is needed to our patients.
When it comes to her work, there are a couple projects that Mindy has facilitated that have touched her heart, funding opportunities that have made a tremendous impact on our community.
I have to say, what I think grant funding can do where it works best is when we use it to start or pilot a program. A good example is our addiction medicine program. When I started here, we really had a very small addiction medicine program. We had one provider, one toxicologist or addiction medicine provider. We maybe had a medical assistant, only really just a few people. At that time, that was when the opioid crisis was really rearing its ugly head. And the state put together RFAs, which are basically letting you know that there's funding available to work on the opioid crisis. And we applied for a series, they were called PACMAC grants, that was all aimed at expanding our addiction medicine services. And honestly, it did exactly what it was intended to do, because over the course of the last 6 years, I think we now have maybe 4 providers, addiction medicine providers. We've grown that program tremendously. Unfortunately, they're busy, very busy. But we first started the addiction medicine clinic, Center for Addiction Recovery. We built that out. Now we have a program within the hospital where we really educating everyone in our emergency rooms and on all the floors of the hospital when they have a patient who they suspect of suffering from addiction. Call the Center for Addiction Recovery so that person can have a seamless transition to treatment after they leave the hospital, so we don't lose that. So that program has grown tremendously. We're going to be doing it in all the 7 hospitals in Central PA in the next year. We have a mobile unit for addiction recovery that goes out to areas within Central PA where we know there are hotspots for opioid use. And we really target particularly rural areas where it's harder for people to get to our clinic, and we can provide treatment in that vehicle. So that's a program that I think where grant funding has really shown that it's worked, because it helped to get us started so that we can grow the program, and now it's a permanent hospital program. And because, we can now generate revenue for patients who have insurance, we've added sustainability to it. So that program in particular is a good one for showing what grant funding can do. Our Nurse Family Partnership Program is almost entirely funded by a grant through the state. The CAC, the Child Advocacy Center, is almost entirely funded by grants. Of course, UPMC also provides support. No program is ever going to be entirely 100% supported by grants. There's always other expenses, which shows the commitment that the health system has to providing these services. But grant funding definitely allows us to expand programs. And I think it also holds us accountable, because there's always a lot of reporting that we have to do on these grants. Because, when the federal government, the state government issues these opportunities, they're doing it to collect data too on particular issues. So it does hold us accountable to do the right thing and to use evidence-based research to guide how we set our programs up. And I think that accountability is good because it keeps us moving forward with it too. We know that if we want to continue to have outside funding to help support a program, we have to meet certain outcomes. We have to do the work. So I think there's a lot of reasons why grant funding is what we do. We also learn from others. I know with a lot of our programs, we will meet with other organizations that are also receiving funding, the same funding, and we talk. When we had our opioid grants, we would get together at the Department of Health on a quarterly basis, and there would be maybe 10 different health systems from around the state who would sit around a table and we'd talk about, what we were doing, how was it going, what was working, what wasn't working. And we weren't competitors in that room. We were all trying to provide as much treatment as we could to folks who were suffering from opioid abuse. And there were a lot of good things that were shared.
So what's next? Mindy fills us in on what she sees for the future of the work of the UPMC Pinnacle Foundation.
I think I see us being even more strategic. And this is something I would like us, instead of kind of reacting to when someone comes to us when the health system is, hey, can you find us grant funding for this? Right? We look ahead and say, here are the top needs of our patients, of our communities that we serve. Let's prioritize these and decide which ones we're really going to try to work on first and then seek out grant funding in that way. And we are doing more of that. But transportation is a big issue for our patients. For so many of our patients, it is a barrier to care across every service line. That's something we're talking about now, looking for funding that can help us really tackle the issue of transportation. Study it ahead of time, devise kind of a pilot program, and then look for funding to help us to do that. I mean, like any job, it has its pluses and minuses, I guess. But if you can read and write and you are interested in doing community work, it really is kind of a great way to do that. If you're always interested in learning new things and kind of have an open mind about things, I think the one suggestion I make for people before you look to apply for like a federal or state grant, which are a lot of work, you need to figure out exactly what's the problem you're trying to solve, who is the population you're trying to help, really flesh that out, and how are you going to do it? You need to already have a very succinct plan as to how you're going to tackle whatever the problem is that you're trying to help solve. Because you really have to have that figured out before you try to apply for a grant. Oftentimes people will come to us and say, hey, I saw this grant, I want to apply for it. And then we find out that they really haven't thought it through as to how they will do it. You do need to have that figured out first. And one thing we're doing, my colleague Angie, who's our grant specialist, and I are really trying to work with folks now who we know are interested in applying for future grants to define what their solution is to a particular problem ahead of time. So that then when the opportunity comes out and maybe you have a month to apply, you're ready to hit the ground with it. But I think really thinking it through and having a very succinct answer to how you will solve a problem is probably one of the most important things. And really knowing your audience, really knowing the audience that you want to help. I mean, I see that sometimes in some of the funding requests we get. It's hard to determine what it is they're going to do with funding that they're asking for. And you never want the person who's reviewing your funding request to not understand what it is you're looking to do.
As we come to the close of today's episode, we want to thank Mindy for sharing her invaluable insights into the world of healthcare grants and the Mobile Wish Unit Project. Her story demonstrates the power of innovative thinking, perseverance, and community-focused initiatives in addressing critical healthcare needs. The Mobile Wish Unit is more than just a project. It's a testament to what can be achieved when dedicated professionals and organizations come together with a shared vision. We've seen how grant funding, when strategically applied, can transform ideas into tangible solutions that make a real difference in people's lives. Mindy's work at the UPMC Pinnacle Foundation exemplifies the crucial role that grant managers play in bridging the gap between community needs and healthcare solutions. As we reflect on this conversation, let's remember that improving healthcare accessibility is an ongoing journey. We hope this episode has inspired you to think about how you might contribute to or support similar initiatives in your own community. We hope you'll join us for our next episode as we continue to explore the stories and initiatives shaping healthcare in our community. Until then, dear listeners,